Sometimes you've been having some back pain and you went to see your doctor and he told you you have degenerative disc disease. And it's been bothering you, but you're not really sure, when should I see that spine surgeon because he's just going to want to do something bad to me. Well, that's not necessarily true. Depends who you see. But if you're seeing me, I'm not likely to recommend surgery on you. But I think it's imperative that we diagnose your problem early so we can make a plan of treatment to keep you away from surgery if at all possible. And if you need surgery, by coming in early, we have many different treatment methods available that are less invasive, they can preserve motion, they can really bring your pain levels down. And surgery is not scary like it used to be. I know everybody's scared of having surgery. I've had 8 procedures on my spine, I know. So I know what you might be going through. And 5 surgeries with 8 procedures. The last one was 3 days ago. So I'm working, I'm okay, I'm a little sore. It's not the end of the world. But we can keep moving forward and I'll help you with a diagnosis of degenerative disc disease to make a plan. So I advocate seeing your doctor, your spine doctor, early for suggestions for treatment.